Well, hello and welcome to the Housing and Services Resource Center's March webinar series. Next slide. Thank you so much for joining us. My name is Lori Gerhard and I lead the Office of Interagency Innovation at the Administration for Community Living, an operating division within the U.S. Department of Health and Human Services. I will be serving as the facilitator for today's webinar. It's great to see so many of you here today, and with your support, we're hoping today's webinar will include an engaging discussion. Next slide. Before we get started, we have a few housekeeping items. This meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees' microphones have been muted for audio quality. But please know we very much want to hear from you today. Please frequently use the chat to make comments and submit your questions anytime in the Q&A feature in the Zoom dashboard. You may also email a question or comment to hsrc@acl.hhs.gov. We have reserved time to address your questions and will compile all the questions to make available a frequently asked questions document. Please use the chat or email if you have a technical issue, and our technical support team will work to resolve it. Next slide. So who is with us today? The work under the Housing and Services Resource Center, or HSRC, is designed to serve professionals in multiple sectors. We'd like to get an idea of who is in the audience by using a poll. The poll will display on the side of your screen. The poll question is, what sector is your organization in? Please select one of the responses. Health or Human Services Agency, Housing or Homelessness Services, Healthcare Provider or System, Community Development Organization, Association, Research or Advocacy Organization, Consumer, Other. Next slide. While you are responding to the poll, I'd like to introduce our federal agency partners and Housing and Services Resource Center colleagues who will be today's speakers. With us today is Ms. Michelle Daly. She is the lead public health advisor, co-occurring in Homeless Activities Branch, Center for Substance Abuse Treatment, Substance Abuse and Mental Health Services Administration, or SAMHSA. Also joining us is Dr. Richard Cho, who is the senior advisor for Housing Services, U.S. Department of Housing and Urban Development. And also joining us is Ms. Martha Egan, who is the Technical Director, Division of Community Systems Transformation, Disabled and Elderly Health Programs Group at the Center for Medicaid and CHIP Services and the Centers for Medicare and Medicaid Services, or CMS. Today, our focus is on expanded opportunities with federal funding for housing and services. You'll hear about the opportunities we have through key funding streams such as the American Rescue Plan to help more people get and keep affordable, accessible housing with the home and community-based services and/or the behavioral and mental health services that they are seeking and need, so they can live full lives in the community. Our intention is that you leave today's webinar and new openings for action as it relates to the funding and flexibilities that are available, and that you'll also be thinking about other organizations that you could be partnering with. We have reserved about 20 minutes to address your questions at the end of the webinar. After the webinar, we'll share a PDF with the slides in this presentation and some additional ones we think are helpful along with an evaluation. Next slide. We are likely all here today because we are grappling with challenges we have in common. The data are quite sobering. We know that the stock of affordable units has been shrinking for many years, and competition for that limited supply of affordable rental units and rising rents makes it difficult, if not impossible, for many older adults and people with disabilities to effectively and sustainably live in the community. HUD's 2021 Worst Case Housing Report found there were only 40 affordable and available homes for every 100 extremely low income renter households nationwide. Adding to that lack of affordable housing is the fact that under 1% of U.S. housing stock is wheelchair accessible, and less than 5% can accommodate individuals with moderate mobility disabilities, making finding units that are both affordable and accessible a huge challenge. Homelessness among adults aged 51 to 61 years and 62 and older are also rising. About 1 in 4 adults in the sheltered homeless population are 62 and older. In addition, many studies have documented that finding, navigating, and obtaining services and supports for living in the community can be difficult. However, even in states that have put in place needed community services to help people transition from institutions, the challenge of finding affordable and accessible housing becomes the issue that slows down or even prevents the transition back to the community. Next slide. So to address these challenges, we recognize that we need to form and facilitate greater partnerships across the disability, aging, health, and housing sectors at all levels. So the U.S. Department of Health and Human Services, specifically the Assistant Secretary for Planning and Evaluation, ASPE or ASPE, the Administration for Community Living, ACL, the Centers for Medicare and Medicaid Services, CMS, and the Substance Abuse and Mental Health Services Administration, SAMHSA, SAMHSA, partnered with the U.S. Department of Housing and Urban Development, HUD, HUD, to create the Housing and Services Resource Center. In December of 2021, the Housing and Services Resource Center launched with a website that brings together, for the first time, a wide variety of federal resources and guidance on both housing and services that support community living, including Medicaid-funded home and community-based services, behavioral health supports, vouchers, and other housing programs. You can access this information at acl.gov/housing and services. It will take all of us working together so people have access to both affordable, accessible housing and the individualized services and supports needed to live in the community. Our shared goal is to enable all older adults, people with disabilities, those living in institutions seeking to return to the community, and people experiencing or at risk of homelessness to live stably in their homes and engage in the community. Next slide. The Housing and Services Resource Center serves as a hub of our federal partnership, and in collaboration with national, state, and local partners, we work together to coordinate technical assistance, training, and research efforts of each agency to reach a broad audience of aging, disability, housing, health, and homeless networks and stakeholders. We facilitate partnerships between housing and service systems to expand affordable, accessible housing and access to home and community-based services and health. We recognize and share state and local innovations, and we assist communities in leveraging and aligning new housing and services resource centers new housing and services resources available through the American Rescue Plan. Next slide. Please close the poll. Wow. Let's see here. It looks like 42% of those joining us today are from health or human service agencies, followed closely by housing or homelessness services and association research or advocacy organizations. And it looks like we also have some consumers in the group and a group of other. We're so delighted to have participation across a full spectrum of housing, disability, aging, home and community-based services, and health. I want to just remind everyone to please use the chat and the Q&A function throughout this webinar. We really want to hear from you and get your comments and questions. Next slide. Now I'd like to share some information about the Administration for Community Living, or ACL. We strive to make community living a reality for all people, regardless of disability or age, and by that we mean living in their own home in the community of their choice. Community living involves access to community services, healthcare, housing, employment, inclusive education, transportation, and more. Community living requires partnership across these sectors. I'd like to share some information about the nationwide disability and aging infrastructure that we support. Next slide. The disability and aging networks are available in each of the 56 states and U.S. territories and communities throughout the nation. Organizations in the networks are staffed by people who live in and know the people, the community, the culture, and the services that are available in the community. They serve a diverse population and work in partnership with other organizations to support people with disabilities, older adults, and caregivers to access and obtain the care, services, supports, and assistive technology they need, enroll in publicly funded programs, understand and use their healthcare benefits, their transportation services and benefits, and find and obtain accessible, affordable housing. They are skilled at helping people with disabilities, older adults, and caregivers braid the array of public programs, private resources, and community programs so people can fully activate their person-centered plan. Please visit acl.gov for more information about these organizations. Next slide. The American Rescue Plan provided ACL with $1.4 billion in Older Americans Act funding, so states and communities can provide services and supports to older adults to live in the community. The Aging and Disability Networks are using these resources to expand or enhance the delivery of in-home supports, transportation, assistive technology, preventive services, meals, care transitions out of institutions and hospitals, programs to address social isolation. Additional American Rescue Plan for meals, nutrition services, and home and community-based services were dedicated to the Native American Aging, Nutrition, and Supportive Services Program. Next slide. You can find your local network organizations through the Disability Information and Access Line, or DIAL, Elder Care Locator, and the AT3 Find Your State Assistive Technology Act program website. We'll put those links in the chat. Now it's my distinct honor to ask Ms. Michelle Daly from SAMHSA to tell you more about the opportunities with behavioral health, mental health, and housing. Michelle?
Great. Thank you, Lori. Good afternoon, everyone. My name is Michelle Daly, and I'm with SAMHSA of HHS. And today I will highlight some programs in which grant funds support housing-related services for those with mental and/or substance use disorders. On behalf of Dr. Delphin Rittman, the SAMHSA Assistant Secretary for Substance Use and Mental Health, and all of SAMHSA, I'm pleased to join my other federal colleagues today as we collaborate and coordinate to support community living for people with disabilities, older adults, and people experiencing or at risk of homelessness through accessible, affordable housing and voluntary community services. We view this effort as crucial to the work we do. So much of our respective agency missions are interconnected, and those we serve deserve this type of collaboration and coordination. For those of you who might be unfamiliar with SAMHSA, our mission is to reduce the impact of substance abuse and mental illness on America's communities. SAMHSA believes that behavioral health is essential to health, prevention works, intervention is critical, treatment is effective, and people recover. Our mission is supported through grant funding, public education and training, surveillance, regulation and standard setting, and practice improvement. While behavioral health is our focus, our work must acknowledge and align with the social determinants of health. We all know that the environments where people are born, live, learn, work, play, worship, and age affect a wide range of our health, functioning, and quality of life outcomes and risks. The COVID-19 pandemic has placed additional strains on individuals, families, and our systems of care that have required us to make adjustments to the collective work that we do at the local, state, tribal, and federal levels. In fiscal year 2021, SAMHSA distributed approximately $13.82 billion. That included $4.25 billion of COVID supplemental funding, and with spending through 2023, and $3.56 billion of American Rescue Plan Act funds, with spending through 2025. These funds were primarily funneled through our block grants that I will talk about in just a little bit. Next slide. This slide includes results from our most recent national survey on drug use and health in 2020. Please note that as a household survey, information from those in institutional settings and for those experiencing homelessness are underreported. You see that for those 18 and above, 15.4% had a substance use disorder. 21% had a mental illness, of which 1 in 4 had a serious mental illness. And 6.7% had both a substance use disorder and a mental illness. If you were to look at HUD's homeless populations and subpopulations reports, specifically 2020 to align with this data, just over 25% are categorized as severely mentally ill, and about 20% as having chronic substance abuse. Those experiencing homelessness have higher percentages of mental or substance use disorders than those with housing stability. Next slide. I will discuss some of the SAMHSA programs that may be utilized to support housing-related and behavioral health services. I want to emphasize that while I discuss a few programs, these are just some of the many SAMHSA grant programs that can support behavioral health services, treatment and recovery support services, and also pre and post-tenancy services. Next slide. The first of which is the Center for Mental Health Services Community Mental Health Services Block Grant, or MHBG. This program provides funds and technical assistance to all 50 states, District of Columbia, Puerto Rico, U.S. Virgin Islands, and 6 Pacific jurisdictions to provide comprehensive community-based mental health services to adults with serious mental illnesses, or SMI, and to children with serious emotional disturbances, or SED, and to monitor progress in implementing a comprehensive community-based mental health system. The state mental health authorities receive the mental health block grant funds and allocate funds to a variety of different types of subrecipients within their states. As part of the mental health block grant funding, states must submit a comprehensive community plan that demonstrates a system of integrated social services, educational services, juvenile services, substance abuse services, health and mental health services, including health and mental health services needed for a person to function outside of an institution or inpatient care, and must describe the state's outreach to and services for individuals who are experiencing homelessness, who have an SMI or an SED. Next slide. This slide provides some examples on how the mental health block grant funds can be used to maintain housing through delivery inside and outside the home, such as intensive case management, treatment, peer support services, and state, tribal, and local coordination of these services. Next slide. This slide includes housing-related activities that are allowable with mental health block grant funds and are examples from state plans that include pre- and post-tenancy supports, such as housing identification, overall housing supports, and crisis stabilization. Specifically, coordinating with public housing authorities and other housing providers to support people with SMI and SED, including those transitioning from institutions. In addition, provide benefit assistance in developing and maintaining supportive housing. So many of the examples in the far right column show approvals received for use with either the COVID-19 funds or the ARP funds that I mentioned at the beginning. Next slide. Another program, the Center for Substance Abuse Treatment and Center for Substance Abuse Prevention, is the Substance Abuse Prevention and Treatment Block Grant, or SABG, which provides funds to the same 59 entities that the Mental Health Block Grant, plus the Red Lake Band of Chippewa Indians of Minnesota, to prevent and treat substance use disorders. CSAT and CSAP administer the SABG. Not less than 20% of the allotment must be spent on substance abuse primary prevention strategies that are directed at individuals not identified to be in need of treatment. The single state agencies for substance abuse services, or SSAs, receive the SABG funds and allocate funds to a variety of different types of subrecipients within their states. Next slide. Next slide. One of the, here you see similar with the mental health block grant, these are some examples that the SABG funds have supported. You will see a number of states actually received approval to do enhanced recovery housing. Recovery housing is actually allowed in the SABG through a revolving loan fund, but for the COVID-19 and ARP funds, states were, it was noted that states can put in for more direct housing and recovery housing with their plans. So you see that some of the pre and post tenancy supports listed are expanding the recovery housing, additional housing stabilization and coordination, and all of these are also coordinated with voluntary treatment and recovery support services. Next slide. Another CSAP program is the State Opioid Response Program. This program awards states and territories through the SSAs, which is similar to the SABG, to address the opioid crisis by increasing access to medication-assisted treatment, reducing unmet treatment needs, and reducing opioid overdose deaths through prevention, treatment, and recovery support services for those with opioid use disorders. This program was expanded in FY20 to support evidence-based prevention, treatment, and recovery support services to address stimulant misuse and use disorders, including for cocaine and methamphetamines. Next slide. Here are a couple examples from Connecticut and DC that are both coordinated with other housing and services systems. The DC example includes outreach services that integrated connections to coordinated entry if people were not already included. Next slide. Another two examples, the Pennsylvania example shows SOAR funds being used to increase case management services in a broad framework, including housing-related, employment, and education, benefit enrollment assistance, and transportation, to name a few. In Ohio, the SOAR funds supported services within a faith-based recovery housing program. Next slide. The next few programs I'll mention are focused on services for people who are experiencing or at risk for homelessness. The Center for Mental Health Services, Projects for Assistance in Transition from Homelessness, or PATH, is a formula grant to reduce or eliminate homelessness for individuals with serious mental illness, or SMI, and co-occurring substance use disorders who are experiencing or at imminent risk of becoming homeless. Next slide. PATH funds are distributed to 56 states and territories, ranging from $500,000 to $8.8 million annually. States use PATH funds to provide a menu of services, and want to note that most states use PATH dollars for outreach and case management. This slide shows some other services. Next slide. Here's a list of housing services states can select from for the PATH program. Most states use PATH funds for security deposits, the costs associated with matching eligible homeless individuals with the appropriate housing situation, and one-time rental payments to prevent evictions. For more information about the PATH program in your state, I'd recommend you reach out to the state PATH contact. Each state has local provider agencies that are doing a lot of coordination and collaboration with HUD, Continuum of Care, and public housing authorities. If you are unable to locate your state PATH contact, please visit the SAMHSA website that includes a list of both state PATH contacts along with provider organizations for your state. Next slide. And here's an example of an Ohio Columbus House that has both PATH funds and a program that I'll mention shortly, grants to benefit homeless individuals. And they are kind of linking those with other housing opportunities through the COC and public housing authorities. They are also working with across other benefit areas and doing a number of employment-based services for those enrolled. Next slide. Another CMHS program is the Treatment for Individuals Experiencing Homelessness, discretionary program that serves people with SMI, SED, or co-occurring disorders who are experiencing homelessness. Grants are awarded for up to 5 years to states, territories, or community-based public or nonprofit entities with annual funding of up to $1 million for a state government and territory and up to $500,000 for tribes and community-based organizations. Next slide. Grantees that receive TIEH funds are expected to do the required services listed here. In addition, strengthening behavioral health treatment, the TIEH program requires enrollment in HUD's coordinated entry system. Next slide. Here's an example of a actually public housing authority that had applied and received TIEH funds. So it's the Grand Forks Housing Authority in North Dakota, and it lists some of the information that they were able to, some of their direct services that they are doing with TIEH funds and coordinating across different service areas. Next slide. The final grant program I will mention is the Center for Substance Abuse Treatment, GBHI program, which is the grants to benefit homeless individuals that focuses specifically on individuals and families experiencing homelessness who had substance use disorder or co-occurring mental and substance use disorder. This 5-year program has annual funding of up to $400,000 a year. And there are 85 current grantees across 33 states to expand community treatment and recovery support services. Next slide. This slide shows GBHI required services. And you'll also see that the FY20 cohort that we awarded are also allowed to use grant funds for up to 90 days of rental assistance and other housing initiation costs, such as security deposits and utility activation. Grantees ensure that people are included in coordinated entry, and you can look at GBHI and other SAMHSA discretionary programs as two-way referrals for HUD housing funds. And I think that this point is really important. We've been hearing a lot of states and communities having difficulty with wrapping service dollars around. So in addition to what you'll hear later from CMS on Medicaid and use of Medicaid funds and their programs, please think about utilizing SAMHSA funds and interacting with multiple systems. Our service dollars are available. A lot of the coordination and programming goes through your state. But in addition, you will find many discretionary programs that are both programs for targeted people experiencing homelessness and general discretionary programs that might benefit those that have been or needing to be placed in housing. Next slide. So in addition to grant programs and funding, SAMHSA provides many other resources for policymakers, administrators, clinicians, and individuals and families. These include our Office on Behavioral Health Equity. Next slide. Also, we have a section on practitioner training, which has a number of different technical assistance centers, and a couple of them are, next slide, the SOAR, the SSI, SSDI Outreach, Access, and Recovery, which helps get individuals enrolled in SSI or SSDI. Next slide. We have our Homeless and Housing Resource Center. Next slide. We have a variety of centers of excellence, one of which is the E4 Center that addresses behavioral health disparities in aging. Next slide. We also have our SMI Advisor program around clinical support systems for serious mental illnesses. Next slide. And we have a peer-run center to help on recovery peer support services. Next slide. As well as many technology transfer centers or TTCs, which are in all of your communities and organized on a regional aspect. Next slide. And then in addition, I'd just like also to make sure you're aware that SAMHSA has an evidence-based practices resource center that has many specific evidence-based practices and guidelines to delivering those systems. Next slide. Here's my contact information, and just want to note that the slides that will ultimately be posted are more thorough and contain additional information, but feel free to reach out if you do have any questions. And I'll turn it right back to Lori. Thank you.
Thank you so much, Michelle. And before Dr. Richard Cho begins, we'd like to learn more about you and your partnerships. Please use the chat to tell us, for your organization, so the name of your organization, who is one of your primary partners that is in a different sector than your organization? So a partner that you work with. For example, for my town housing authority, a key partner is my town Independence Center. If you can put that in the chat, that would be great. We really want to hear what kinds of housing services partnerships already exist across the country. Now it's my distinct honor to hand the presentation over to Dr. Richard Cho from HUD to share housing funding opportunities and highlight great partnership models. Dr. Cho?
Great, thank you so much, Lori, and great to be on here alongside you and Michelle and Martha. I'm here as a senior advisor to Secretary Marcia Fudge at HUD, the Department of Housing and Urban Development, where I advise her on all of the ways that HUD can connect housing with services for populations who need that combination of housing and services in order to remain successful and remain stably housed. And that includes people experiencing homelessness, but also older adults, where the provision of long-term services and supports coordinated with housing can enable them to stay in place as long as possible, avoid institutional care, as well as people with disabilities who need the combination of housing and services in order to fully participate in the community and live in the community. I want to talk a little bit about HUD's mission and about some of our programs, but I really want to send a clear message about the importance of partnerships, which you've heard a lot about already, and I'm curious to hear about some of the responses in the chat. If we can go to the next slide. So just wanted to make clear, our role is really to help provide stable housing for all, as well as to create strong and inclusive, sustainable communities. And we see home and community-based services as vital to our mission. We have a number of programs that are housing programs that are specifically intended to provide affordable housing or housing assistance to older adults, people with disabilities, and people experiencing homelessness, and where we essentially know that the success of that housing can be stronger and to the degree to which our residents have access to long-term services and supports, home and community-based services or other wraparound services that are coordinated with that housing that can help people to, again, maintain long-term tenancy as well as live with dignity and independence. So that is essentially what a lot of this is about. On the next slide, I'm going to go through just a couple of categories of the housing programs that we administer, and starting with the programs we have for specifically for older adults, which at HUD we define as people or households in which at least one person is age 62 and older. We have a couple of different ways that we provide housing assistance. One and the most commonly sort of known way is through our multifamily programs, in particular the Section 202 program, which specifically provides a combination of capital funding to help build housing units for people who are older adults, as well as provides long-term rental assistance. And so we essentially pay for the bricks and mortar as well as the rental assistance to keep those units affordable. Nationally, we have about 6,800 properties that includes about 330,000 units across the country. In addition, through many rental assistance contracts that some of which are no longer new, but which we've renewed those contracts, which we refer to as project-based rental assistance. There's another, say, 11,800 properties that have about 1 million units. And what our data shows is that about 50% of those units serves older adults. Those were not units specifically targeted to older adults. They were really based on people who are low income. But what we found is that 50% of those project-based rental assistance properties actually is serving households in which at least one member is an older adult. And then, of course, we have public housing, which is administered by our public housing authorities, as well as housing choice vouchers. And what we found is that about 150,000 households who live in public housing have at least one member that's an older adult, and about 220,000 households who have housing choice vouchers. So these are sometimes referred to as Section 8 vouchers, but they're essentially vouchers that people can use to rent units on the private market and keep those rents affordable. About 220,000 of those vouchers are households that have a member that's an older adult. So quite a few people, households that HUD serves have at least one member that's an older adult. And as much as most folks think about Section 202 as the place where we provide older adult housing, in fact, we provide older adult housing across most of our programs. On the next slide, we also administer a number of programs that provide housing assistance specifically for people with disabilities. That includes physical disabilities, intellectual and psychiatric disabilities, and that includes our Section 811 program. We have both a capital advance program where we provide a combination of capital funding as well as rental assistance for about 2,700 properties with 30,000 units nationally. And then a newer version of that program is our project rental assistance program, where rather than providing bricks and mortar, we enter into rental assistance contracts. The Section 811 project rental assistance program is one where we provide funds not directly to housing owners, but rather to state housing finance agencies, where they're required to partner with Medicaid and agencies that serve people with disabilities to really provide a combination of housing and services. And so the 811 program is one of the places where we have reinforced the need for those state level partnerships between housing agencies who administer not only the 811 program, but also low income housing tax credits, as well as the agencies that fund and finance supportive services. And then again, many people with disabilities live in our public housing programs and our regular housing choice vouchers, but we also have some special voucher programs that are intended to serve households that have a disability. That includes our mainstream vouchers, about 50,000 vouchers. Actually, I think it's closer to 60,000 now that serve at least a household with at least one member with a disability. And then also non-elderly disabled vouchers, which we call NED vouchers, about 55,000 vouchers as well. So we have a couple of different voucher programs that are specifically intended to serve people with disabilities. And one of the kind of primary intents of that is to not only serve people with disabilities who are transitioning from homelessness or who are need to avoid homelessness, but also people who are currently in institutional settings, where the provision of the voucher plus money follows the person programs and home and community-based services, they can live in the community. So there's a particular opportunity there. Next slide. And then, of course, we have our targeted housing assistance programs for people experiencing homelessness. Our primary vehicle is through the Continuum of Care program, where we provide grants on a competitive basis annually to communities across the country who have to apply as part of a continuum of care. In other words, a number of homeless service organizations who receive HUD grants, they apply as part of a sort of collaborative at the local level, and that collaborative is known as a continuum of care. And that continuum of care is intended to help set local priorities for how HUD dollars will be used, and then to kind of serve as the umbrella for how a number of homelessness grants are funded. So through the Continuum of Care program, HUD has funded both permanent supportive housing, which is intended to provide long-term rental assistance along with wraparound services, or where those services are leveraged through partnerships, We have about 3,700 permanent supportive housing projects across the country, as well as rapid rehousing programs where people experiencing homelessness are provided with time-limited rental assistance, typically up to 2 years, but sometimes less, as well as case management assistance that is primarily about finding housing as well as helping people stabilize in that housing. And so those are the two ways that we fund targeted housing assistance for people experiencing homelessness. On the next slide. The message I really want to send today, and you've heard this from Michelle, and you'll hear this from Martha, is that there are so many opportunities. I continue to hear from many communities that they struggle, they may have HUD resources to provide housing assistance, but they're struggling to figure out how to find funding or resources to provide the wraparound supports that enable them, whether it's an older adult, a person with a disability, or a person experiencing homelessness, to be able to use that housing effectively and also to stay in that housing. And the message I want to send is that we actually have these tools. We certainly need more resources. We need more resources on the housing side. We could use a lot more resources on the supportive services side, but we essentially have the tools that enable us to kind of put these puzzle pieces together so we can better coordinate housing assistance with long-term services and supports or home and community-based services. First and foremost, Medicaid, I think, is probably the most effective way to cover a range of home and community-based services and long-term services and supports that can help support people's ability to obtain housing, as well as retain housing, as well as support their community living and their ability to live with independence in that housing. And then a number of HUD programs that I've already mentioned that can be coordinated with those services to provide rental assistance or affordable housing, including for people who are transitioning from institutions or homelessness. The key is really to, first of all, break down the silos. And so I'm really curious what many of you have commented in terms of who your most important partners are, but really how to build that bridge across sectors, working between housing and the health and services sectors. And not only just building that bridge, but really to engage in what we hope to see as high-level planning at the state level, where you can take a bird's eye view and say, how can we look at the entirety of housing that's available for older adults, people with disabilities, and our homeless programs to really design a package of supportive services that can be coordinated with those existing housing programs, as well as design ways to streamline assistance so that when people apply for homeless assistance or housing, they can also figure out how to obtain access to those supportive services so they can obtain that as a sort of coordinated package. On the next slide. I think starting for those of you who work in the health and supportive services and human services arena, I know that it can be a dizzying thing to sort of navigate the housing system landscape. And so here's an attempt to try to just give a very perhaps oversimplified view of how the housing system looks. Certainly you have HUD, and we fund, some of our programs go to state housing agencies. Some of them go directly to municipal or local housing agencies. We also have a number of funding programs where we fund public housing authorities. And then we also provide funds through continuum of care to homeless service organizations. In some cases, a public housing authority can provide direct assistance to, say, an individual, either through public housing or through vouchers. In some cases, they actually are providing rental assistance contracts within a privately owned housing development, which is owned by a housing owner or provider, who may also be obtaining capital funds or tax credits from state housing agencies or municipal housing agencies. And so I think the key message here is that you need to really understand what the housing landscape looks like in your own states and identify who those partners are, and see if you can kind of bring as many of them together to the table to say, we have an opportunity to provide supportive services. Many of the people that we're providing services to need better access to housing, or we need to figure out how to coordinate this. This is the kind of mapping exercise that I'm hoping many of you who work in the services space can engage in to just identify who the partners are that we need to meet with. And similarly, on the housing side, understand who is your Medicaid agency, who provides money follows the person services, currently provides home and community-based services, what services are covered for what populations, how does your state behavioral health agency fit into the mix, and your area agencies on aging, your centers for independent living, and other agencies that serve people with disabilities. There's a kind of mapping exercise that needs to happen at the state level so we can engage in that really bird's eye view, comprehensive planning that I think can take full advantage of these resources to create opportunities, housing and services opportunities for the populations we're speaking about. On the next slide. I want to give two examples here of states that have engaged in this. One of them is in Vermont, and where back in 2011, Vermont engaged in a multi-payer advanced primary care practice demonstration where they took their Medicare payers and Medicaid managed care organizations, they brought them all around the table and said, how can we improve access to care and the delivery of care and health outcomes for older adults, but also look at ways that we can get to greater efficiency. And they engaged in a process where they said, let's map where all of the older adult housing is, whether it's Section 202 housing, public housing, or other low-income housing that serves older adults. And let's just map where they are and figure out, is there a better way that we can ensure that older adults in that housing can have access to the services that can be tailored to their needs as their needs go up or down. And typically, older adults may, their health needs may increase as they age and they need more services. How can we provide a way to deliver services to as many older adults in low-income housing as possible? And where we're not doing it on a sort of person-by-person basis, where like we don't actually know who the service providers are, but in a sort of statewide context. So they engaged in this proactive, collaborative redesign of the way that they're providing long-term services and supports to older adults. And they sort of organized service delivery into 55 regions or sort of panels, and they appointed a service coordinator and a wellness nurse to coordinate the care of all the residents of multiple HUD-assisted housing within their sort of catchment area and region. And then also to serve people who may not be living in HUD-assisted housing, but who are in surrounding communities. And those coordinators and wellness nurses provide that sort of high level kind of touch, but also as the glue where they're brokering connections to a broader array of services and supports. That's the kind of model that I think, may be unique to Vermont, but I think that a similar kind of approach can be taken again if states engage in a sort of proactive kind of bird's eye view process to sort of design the coordination of housing and services at the state level. Another example on the next slide, please, is in Louisiana. Back in the aftermath of Hurricanes Katrina and Rita, where the state of Louisiana was facing significant disasters, many people experiencing homelessness who were displaced, they actually received an allocation of 3,000 special vouchers to house people experiencing homelessness who were affected by those hurricanes and disasters and place them into permanent housing. And so recognizing that they were getting a windfall of sort of housing resources, Louisiana decided that they had an opportunity to figure out how can they pair and coordinate wraparound services for people who are going to receive those vouchers, who are people experiencing homelessness, as well as people leaving institutional settings who had disabilities. And what they decided to do was engage in a partnership between the Medicaid agency, which is the Louisiana Department of Health, to work with the Louisiana Housing Corporation and housing authorities across the state to really design a new approach to providing wraparound services. Through a variety of Medicaid authorities and state plan amendments and waivers, which I won't get into, they essentially designed a way to ensure that as many people as possible who are experiencing homelessness, who had disabilities, could receive wraparound services, and came up with a way for people to apply for both vouchers as well as Medicaid funded services in a coordinated fashion. Next slide. So, that was Louisiana, and they had this opportunity to partner because of those special resources. Well, I think in many ways, nationally speaking, we have our own Hurricane Katrina and Rita moment, which is that COVID-19 has really exacerbated and laid bare the degree to which we are dealing with a housing crisis and a homelessness crisis in our country. And so through the American Rescue Plan, there have been essentially a windfall of resources provided to communities in the form of new housing resources to address homelessness. $5 billion in new emergency housing vouchers. So there are now 70,000 emergency housing vouchers that are intended to serve people experiencing or at risk of homelessness that have been awarded across the country. HUD has also awarded $5 billion in grants through our Home Investment Partnerships program that enables communities to build more permanent supportive housing, other affordable housing, including where they're purchasing and converting hotels and dormitories really quickly into affordable housing, as well as provide short-term rental assistance and supportive services. There's been funds at Treasury to provide emergency rental assistance for people who are falling behind in rent or facing evictions, and another $350 billion in Treasury, state, and local fiscal recovery funds, and many communities are looking at how they can use those also to support housing and homelessness activities. So there's more resources than perhaps I've seen in certainly my long career in this field, but perhaps really in our lifetime in this particular moment to address homelessness. And so this is the moment when I'm hoping to see many more housing and services partnerships and collaborations at the state level to figure out how do we capitalize on this moment where we have significant housing resources to figure out how do we also finance wraparound services so that people can have that package together. And then finally, on the last slide, one of the things, other opportunities is that HUD has launched a national initiative. Secretary Fudge has invited mayors, governors, and county leaders into a national partnership called House America, where she's asking them to pledge to HUD how many people experiencing homelessness will be rehoused, and how many additional units of permanent supportive housing will be created. I think this is another opportunity through House America to be able to identify which leaders to partner with at the sort of state and local levels. And I'll place the House America information in the chat. But Lori, I'll turn this over to you.
Thank you so much, Richard, for that overview of examples and resources and sharing the House America initiative. We really want to encourage communities to join. The chat has been really busy too, Richard, as you were speaking, and people really like the flowchart idea. And I'd like to just take a moment and to thank all of you too for sharing your partnership information with us. We are seeing lots of different types of partnerships in the chat, and I'll just mention some of the types of organizations: housing and area agencies on aging, state associations of community action centers, senior centers, centers for independent living, state councils on independent living, Los Angeles Homeless Services Authorities, CSH, the Mayor's Council on Disabilities, organizations supporting people who are leaving jails, housing authorities, federally qualified health centers, state housing finance agencies, and many more. So many thanks for sharing those ideas with us. We'd like you now to also share with us in the chat a note about how you are working with partners to use American Rescue Plan Act or other funding to address local housing challenges. And while you're providing us with your best examples of how you're using these funding opportunities, I'd like to turn it over to our distinguished colleague, Ms. Martha Egan from CMS, who will highlight opportunities with Medicaid and Medicare. Next slide. Martha, the floor is yours.
Great. Thank you, Lori. And I just want to start off by saying that CMS is really excited to be part of this this federal partnership panel with ACL, HUD, and SAMHSA on helping people to obtain or maintain stable housing and access to home and community-based services. And I just really want to start off by saying that, you know, CMS really does recognize that access to affordable and accessible housing opportunities and high-quality HCBS really dependent on strong partnerships and resources at the local, state, and federal level. And really, no one agency, organization, program, or provider can do the work of increasing affordable and accessible housing opportunities in a silo or on their own. So these partnerships are absolutely key. And additionally, I think we want to also point out that CMS really recognizes that strong partnerships at any one of these levels can lead to approaches that put individuals at the center of their care. It helps to meet people where they are and to coordinate care seamlessly across settings. And this is whether individuals are transitioning from institutional settings to the community, from congregate settings to more integrated community-based housing, from the street or a shelter to a home, or gaining more independence and safety in a home of one's own. So I'm going to start with a very brief discussion of HCBS, or Home and Community-Based Services, and its relationship to helping Medicaid beneficiaries to obtain and maintain affordable and accessible housing. And then I'm going to talk about two current and very exciting HCBS initiatives under the Medicaid program that can provide opportunities for state Medicaid agencies to collaborate and partner with state and local housing agencies and organizations and all the housing resources that are now out there to help individuals transition into affordable and accessible housing. So let's go to the next slide. So home and community-based services under the Medicaid program. So as a very quick reminder, HCBS, these are optional Medicaid services. And one reason we really want to kind of point this out is to remind folks that the state HCBS programs are very unique. One HCBS program, one state HCBS program is going to look very different from another program. So the packages and benefits and the delivery of these services are going to look very unique and different from state to state. And HCBS services can include services and supports such as, but certainly not limited to, things like case management, homemaker services, home health aid, and personal care services, adult day health services, habilitation and respite programs. And HCBS services support a wide diversity of individuals. And really key to today's conversation, HCBS can provide services to help individuals to access affordable and accessible housing and to achieve housing stability and community living goals. So generally, under the Medicaid program and under certain Medicaid authorities, housing-related supports may include things like one-time moving costs, such as a security deposit or a setup fee for utilities. Housing-related supports can also include pre-tenancy supports, which can include activities such as assisting an individual with the housing search. It can include tenancy supports, which can help an individual to maintain their tenancy once their home or has been secured or established in the community. It can include home accessibility supports, which can include things like installing a wheelchair accessible ramp or grab bars in a bathroom. And finally, Medicaid can be a very key and integral part of a collaboration with other community-based programs, including state and local housing agencies. But as a reminder, Medicaid does not cover room and board except in certain medical institutions. And I certainly want to encourage you, if you want more information on housing-related supports under the Medicaid program, to take a look at a CMS state health official letter on the social determinants of health, which we issued back in January of 2021, so about a year ago. There is a link provided to this particular letter on my last slide. So kind of in a nutshell, okay, so HCBS can cover housing-related supports under certain Medicaid authorities. And these are the kinds of supports that can help older adults or individuals with a disability to obtain and maintain housing. And HCBS really is a space or an arena where states can employ very innovative strategies around helping individuals to access and maintain affordable and accessible housing, and also to build these key partnerships between state Medicaid agencies and state and local housing agencies. So let's go on to the next slide. Okay, so now for the next two slides, I'm going to talk about these two new opportunities. And the first one is Section 9817 of the American Rescue Plan Act. And these are HCBS initiatives under the Medicaid program. Again, they can provide incredible opportunities to increase access to affordable and accessible housing and opportunities for states to really advance health and housing partnerships. So under the American Rescue Plan, under Section 9817 of the American Rescue Plan, states were provided an estimated $12.7 billion to states' HCBS systems through a 10 percentage point increase to the Federal Medical Assistance Percentage, or FMAP, that states can receive for certain Medicaid home and community-based HCBS expenditures. And this increase is available for a one-year period from April 1st, 2021 to March 31st, 2022, and states have an additional 2 years through the end of March 2024 to spend basically what is the amount equivalent to the amount of this additional funding, to this increased 10 percentage point increase that they receive on activities to enhance, expand, or strengthen HCBS. So under Section 9817, states are currently planning, and in some cases, states are already implementing initiatives, activities, and programs that are designed to enhance, expand, and strengthen HCBS. Now, while states cannot use the funds to pay for room and board, we are encouraging states to use the funds to build Medicaid housing partnerships, to provide housing-related supports and services, or to implement other allowable activities that can help to address the housing needs of people receiving HCBS. Now, for example, or for instance, some states are using the funds to expand or enhance housing-related supports for individuals transitioning from institutional settings and for individuals who are experiencing or are at risk of experiencing homelessness by providing, for example, intensive case management and outreach services, and increasing support for community transition services. Some states are looking at ways to enhance and expand home accessibility options for individuals with a disability and older adults by providing flexible funding for home modifications, for home repairs, assistive technology and equipment to better support people to remain in their homes. But one thing that we're especially excited to see is that some states are proposing to use the funds for capital investments, including to expand access to affordable and accessible housing into non-disability specific settings as part of a state's HCBS options. And in fact, we strongly encourage and want to work with states to use the ARP funding to make investments in their HCBS systems that will lead to structural or systemic changes and improvements. Now, for example, grants or loans to explore, encourage, or build affordable senior housing and capital and or financing for affordable housing development are permissible if the funding is to support the expansion or establishment of settings that comply with the HCBS regulations. And again, such expenditures are not room and board costs, but are these capital investments to increase the capacity of settings that further community living and community integration. One important caveat to put out there is that an approval of a capital investment activity under Section 9817 of the ARP, it does not authorize such activities for federal financial participation, or FFP. So that's 9817 in a nutshell. And let's move on to the next slide and talk about another opportunity out there. So as many of you probably do know, the Money Follows a Person, or the MFP program, this is a long-standing grant-funded demonstration that has helped states to rebalance their LTSS, or long-term services and support systems, and to support people who are in institutional settings like nursing homes to move back to the community. And since the inception of the program, I think well over 100,000 people with disabilities and older adults have transitioned to the community under the MFP program. In the last couple of years, the MFP demonstration, it has been operating under a couple of short-term funding extensions. However, the program was provided additional funding for 3 years under the Consolidated Appropriations Act of 2021, and this was really, really very welcome news by many stakeholders, and really importantly, under this legislation, under the CAA, a couple of additional MFP changes were enacted. One, the CAA did expand participant eligibility for the MFP demonstration. It reduced the minimum length of time that an individual needs to be in an inpatient facility before qualifying for MFP from 90 days down to 60 days. And it also allows the days a person receives skilled nursing services or skilled rehabilitative services in a certified skilled nursing facility to be counted towards the length of stay requirement. And what's exciting about these changes is that it does allow more people to qualify for the program and allow people to qualify earlier in their institutional stay, which should make it easier for some people to return to the community. And second, the funding extension allows CMS to provide an opportunity for more states to participate in the program. And currently, 35 states, including DC, are participating. However, additional states have not had this opportunity to join the demonstration in a number of years. So CMS, we are expecting to release a notice of funding opportunity in the very near future, which will provide additional states the opportunity to participate in the program. And additionally, under the MFP program, states' current MFP participants or grantees were offered a $5 million supplemental funding opportunity for what we are calling Hpbs capacity building. And one area that the supplemental funding can support is developing and strengthening Medicaid and housing partnerships. And I will say that several of the MFP programs are using the supplemental funding to strengthen their Medicaid and housing partnerships. States, and I just want to point out too, under MFP, why MFP is so important for this health and housing, for this intersection of health and housing, is because under the MFP demonstration, states can really cover a number of housing-related services and supports, including one-time community transition costs. They can also employ housing specialists and housing coordinators, and these are staff who can either help with sort of system-level partnership building to increase affordable and accessible housing opportunities for people transitioning out of inpatient facilities. They can also include housing coordinators, which work more at an individual level and work with individuals to identify and secure affordable and accessible housing in the community. The MFP demonstration can also fund housing infrastructure activities, such as the development and maintenance of statewide housing registries. So there's lots of opportunities under the Medicaid program to really strengthen housing and health partnerships, to strengthen housing and health partnerships. So we are really, really looking forward to working with current and any new MFP grantees to advance innovative strategies to provide housing-related supports to individuals who are transitioning from institutional settings, also to address any gaps in the housing services and supports that states can cover under the MFP program, and to build stronger and more effective housing partnerships. So again, some very exciting opportunities. Let's go to the next slide. And this, I'll be very brief here. This is just a list of some resources, some CMS or Medicaid resources that are available on Medicaid.gov, and these may be helpful to you when working on your health and housing partnerships. So we just want to make sure that you have these available. If you have questions on any of these resources, certainly feel free to reach out. So Lori, I'm going to turn it back over to you.
Well, thank you so much, Martha. That was exciting information. And thanks to Richard and Michelle. You guys have shared so incredible resources, opportunities, and partnership examples that are already underway to support our collective work to build and strengthen housing and service partnerships throughout the country. Before we move to the question and answer part of the session, we'd like to do a quick lightning round with all the speakers to share some strategies to advance equity. So in each of our focus areas, housing, home and community-based services, and health, there are marked disparities in historically underserved communities. Each of our agencies is committed to advancing equity. How can state and community partners advance equity? One way is to involve people who live in the community and are representative of the community they serve in the design and the delivery, the systems changes of the programs. We're now going to do a quick lightning round with each of my federal colleagues, having 2 minutes to share 1 or 2 practices that state and community partnerships can use to advance equity. Martha, let's start with you.
Okay, I have 2 minutes. So how cross-sector partnerships can advance equity. And I just want to start off by saying that, Medicaid really is a key driver of health equity, and health equity really is at the forefront of Medicaid policy. But, CMS has fully recognized that cross-sector health and housing partnerships can work to address health disparities and advance health equity, and really in a number of ways. One, strong partnerships can really integrate a diversity of community perspectives. Secondly, health and housing partnerships can harness the collective capabilities of local, state, and federal governments and community organizations and provider networks. Health and housing partnerships can help to break down silos that sometimes can actually isolate or even perpetuate disparities and sometimes create barriers to health and housing stability. And finally, cross-sector collaborations can really work to advance and accelerate system transformation. So, over the past several years, CMS has really been committed to supporting states in numerous ways around building housing and health partnerships. For example, CMS launched the Medicaid Innovation Accelerator program, or IAP, and this particular program provided opportunities for state Medicaid agencies to develop partnerships with housing agencies and to work on detailed action plans to meet the needs of diverse Medicaid eligible populations, individuals transitioning from institutional settings, individuals experiencing or at risk of homelessness, individuals at risk of institutional placement, among others. More recently, CMS convened 10 states and a learning collaborative to build state health and housing partnerships focused on the needs of individuals experiencing homelessness and substance use disorders under the Support Act. And CMS, continues to provide technical assistance to states around leveraging the flexibility under the Medicaid program to cover services and supports to enable Medicaid beneficiaries to achieve community living goals and to achieve and maintain housing stability. And the provision of these services often requires sharing data across sectors and building relationships among community and state partners to inform not only decision-making, but also to improve community living and health for a diversity of Medicaid populations. So as a practice, CMS really wants to encourage states and communities to participate in these types of learning and engagement opportunities and to fully leverage the opportunities that were presented under Section 9817 and under the MFP program. And really, participation in these types of activities can lead to strong partnerships that can collectively and continually address equity. Lori, back to you.
Thank you so much, Martha, for those examples. Michelle, we'll turn to you next.
Great. Thank you, Lori. SAMHSA promotes equity across all efforts through our Office of Behavioral Health Equity, utilizing the following key strategies: data, policy, quality practice and workforce development, and communication. So you keep hearing us reinforcing partnerships and collaboration. This is really critical when it comes in looking at equity. Data, just to mention, a lot of the data to look at outcomes and access don't come from one system. So really looking hard across multiple systems to access data that can tell you a more complete picture of those you're serving and or how to set up your policies. Through the work around health equity that we're doing, we're striving to eliminate structural and racial barriers to health and well-being for vulnerable and marginalized populations. One collaborative effort that I'd encourage you to take a look at that SAMHSA is involved with, it's also with the National Institutes of Health, the National Institute of Minority Health and Health Disparities, and the Annie Casey Foundation, which funds the National Network to Eliminate Disparities in Behavioral Health, or NNED, that coordinates the NNED Share collaborative space in which people can share, learn, and connect with others on efforts to improve delivery of behavioral health care interventions. So we will put some links for those in the chat, and I encourage you to take a look at that. Thank you, Lori.
Thank you, Michelle. And Richard, we'll turn to you next.
I'll try to be brief because I will echo everything that Martha and Michelle said. I think it's really key. I think in many ways, and I think Martha touched on this, these housing and services partnerships that we're talking about is a strategy to advance equity, because we know that people who have housing but lack supportive services, or vice versa, who have services but lack housing, the lack of having the combination of those things can further increase disparities, particularly for people with disabilities, but also based on race. And I think if you look at who it is that lives in HUD-assisted housing, that winds up in institutional care, the data will likely show that it is older adults of color that have a greater risk of entering institutional care. Similarly, people with disabilities, there's data that demonstrates that when that people with disabilities who lack access to housing and services have a higher risk of entering into institutional settings. And certainly the data we have on homelessness shows that that there are significant racial disparities in homelessness, where, for example, whereas Black Americans represent 13% of the general population, they represent 40%, sometimes higher, of the homeless population. And we've had communities that have not really sort of been intentional about addressing equity, and where they may have actually been successful in reducing rates of homelessness overall, but without having a kind of attention on equity, what they've done is actually exacerbated racial disparities, where essentially white people who experience homelessness have been getting access to housing assistance. Many of the kind of tools that are used to prioritize access to housing assistance, as well as to determine who's eligible for various services, often have racial biases built into them as well. And so I think it's really important to look at those tools. And then I'll just echo what both Martha and Michelle said. Data is really key. As I noted, those disparities I mentioned come from data analysis that many communities have done, where they've looked at the demographics of who experiences homelessness or who gets housing and services coordination in their communities. And then lastly, to look at how who is getting access to those services. Are we being equitable with respect to who is actually in need of those housing and services? So that's definitely key. But I think a really key part of this is to center these efforts around equity, to keep that front of mind. And then, of course, I'll just continue to be on my soapbox to say these housing and services partnerships, that is a key strategy. A definition of equity is the recognition that people need different levels of assistance to be able to achieve equitable outcomes. Not everybody needs the same thing. We can't assume that if we just have systems and approaches that are intended to serve all, that everybody's going to have equal access. We need to provide higher touch for certain communities and populations, and do the special things. And that's what equity is all about. To me, that coordination of housing and services is key to really advancing equity.
Thank you, Richard. And thanks, Michelle and Martha, too. In listening to your practices, many are steps that most organizations can take to deliver resources and benefits equitably to all. I think you've shared some really great ideas and some good resources, too. So I have to tell you that we've generated lots of questions, and we have probably about 8 minutes or so we can spend on some Q&A, and we'll go ahead and get started. But please know, if you've asked a question we haven't responded to during this session, we'll add it to a frequently asked questions document and respond to it at that time, and those will be posted with the slides. So our first question is for Martha, and it would be very helpful to hear how Medicaid can be used to support housing needs and the specific allowability, including through waivers. Thank you.
Wow. Well, we would need, multiple webinars on that, but I just want to say, I would say really quickly, there are multiple pathways under the Medicaid program to provide housing-related support to individuals. And whether it's done under an HCBS waiver program or under, again, as I mentioned earlier in my presentation, under some of the state plan services, HCBS state plan services, there are just multiple pathways. So CMS offers all kinds of technical assistance to help states. The Medicaid program is a partnership with states, between CMS and states. So, we can really work with states to figure out what these pathways are, what will work best for states. But in terms of informing yourself around what these services and supports are and how they can be implemented under different Medicaid authorities, again, I would encourage you to take a look at that social determinants of health letter that we issued back in January of 2021. And it really does kind of outline and explain all the different types of Medicaid authorities and how you can deliver or address social determinants of health, including housing, under the Medicaid program, and start there.
Thank you, Martha. Our next question is, let's see here. This is for Richard. Richard, how is HUD incorporating the planning of housing placement in relation to mobility transportation in the community? It is important that they are able to get to work, jobs, school, healthcare, and complete daily tasks that require transportation, as most do not own a car. Richard, you want to take a stab at that?
Yeah, we certainly don't have it all figured out at this point, but we're looking at a couple of things. First is with respect to vouchers, where people can take rental assistance and find housing in the private market. There's a lot of compelling research that shows the importance of certainly voucher policies and payment standards in opening up access to a lot more parts of where housing exists, but also the role of mobility counseling in helping people to find communities of opportunity, as well as communities where there's higher chances of having proximity to jobs, as well as transportation and other amenities. And then with respect to siting housing, I think we're doing things on a number of fronts, including looking at how we can help support the sort of more equitable sort of siting of housing, looking at how communities zoning and other practices are creating barriers to providing housing in communities where they may have a greater chance of having access to transportation. So those are a couple of things that we're looking at across our different programs, but we frankly have a lot more work that we could be doing in that space.
Thanks, Richard. And I'll just add to your response too that HHS and HUD are part of the Coordinating Council on Access and Mobility that's led through the Department of Transportation. And we are really working together about how we can increase greater access to transportation. There is a website, which we'll put in the chat for the CCAM, CCAM, where there's some resources there on how to braid together some of the federal funding to really help increase access to transportation in communities. So there's several resources too available, but like Richard's saying, we're working at this together, and we still have some work to do in this area. Richard, I have another question here. This one is, our local housing authorities do Section 8 housing choice vouchers. How would one find out about other vouchers available in our community?
Yeah, actually, so a really good, useful resource, I believe it's on the Housing and Services Resource Center webpage, is our Housing Choice Voucher Dashboard, where we have publicly available information on which housing authorities have which type of voucher. So there are certainly regular housing choice vouchers, but there are also what we call special purpose vouchers, and that includes two I mentioned already, the mainstream vouchers and non-elderly disabled vouchers, but also the HUD-VASH program, as well as Family Unification Program vouchers. I'll make sure the link is in the chat, but our Housing Voucher Dashboard provides information that you can go down to the individual state or housing authority level to see how many vouchers they have of each category and how many they've actually leased up, which means if you subtract the leased from the total, it gives you the number of available vouchers that are in that dashboard. And so I believe page 7 of the Housing Choice Voucher Dashboard shows you where the special purpose vouchers are, such as those that are for people with disabilities or for veterans.
Thank you for sharing that. We had another question about Capable and whether there are any grants for home modifications. And so I'll just share that we are aware that Johns Hopkins School of Nursing does have an RFP on the street. I think it closes on March 16th, looking to establish a national center for promoting Capable. So if you are interested in learning more about that opportunity, please email us at hsrc@acl.gov. We'll be happy to respond to you. And we've got another question here.
Lori.
Oh, go ahead.
Lori, I was going to add just really quickly, there are a number of states that are using the Section 9817 funds under the American Rescue Plan Act to fund capable programs or capable models. And I can work to identify those and let you know what states are actually working on capable programs under 9817.
That's great. Thank you, Martha. Did anybody else want to add anything on home modifications or capable? Okay. Our next question is, my office has a program to make housing both owned and rental more physically accessible if the person with a disability is a Medicaid recipient and or veteran and residing in Rensselaer and or Columbia County. I'm not sure who to partner with to inform them so that we can be more helpful to residents. I'm new to working with programs as my second job for my offices. Thanks for anyone who has time to make suggestions. So organizations that people could partner with if they help make homes more accessible. So I'll start. I know that the State Unit on Aging, the State Independent Living Councils, the Center for Independent Living, and area agencies on aging, aging and disability resource centers would all be interested in learning about your organization and the work that you do. They oftentimes come in contact with people who are looking to make homes more accessible and could help get you connected to people that that would be looking for your knowledge and expertise. Okay. And I'm just looking here. We have another question around what is HUD doing to address the fact that many landlords won't accept housing choice vouchers and that rents are skyrocketing with inflation?
I can certainly take that one, Lori. We know that there are challenges right now. Some of the data that we have shows that rents are spiking all over the country. Some of that is related to the, I think, effects of the pandemic, and that many communities have voiced to us that there are challenges with finding available units to lease with vouchers. So we're aware that this is pretty universal. What we've seen to be really effective at the community level is where housing authorities and their other service partners are taking advantage of some of the waiver authorities that HUD has provided to them, particularly through these new emergency housing vouchers, where we were able to provide, thanks to the American Rescue Plan, additional admin fees and service fees that come with those vouchers. And many housing authorities are using those to do everything from paying for additional housing navigation services so that someone who's been issued a voucher can actually find housing, or actually creating landlord incentive programs and providing either signing bonuses. I know some communities are also creating landlord incentive programs where if a landlord has a apartment, but they know it won't pass housing quality standard inspections, that they can actually provide them with a one-time grant to make repairs and bring that apartment back up to meet HQS inspections. I think it's a really creative use to get more units available online. Where you have instances where landlords are saying, I refuse to lease to a voucher holder, that is something that in many states, it's actually states have passed laws that provide source of income protections for people so that a landlord cannot discriminate against somebody who has a voucher. There is currently not a federal protection for that, but in many cases, when those kind of instances happen where they refuse to take a voucher holder, there may also be sort of things happening that require sort of looking at where their potential fair housing violations have also existed. And so certainly if that ends up being a de facto denial of somebody who is a protected class, whether that's based on race or disability status or familial status, that's something that certainly should be looked at. But again, I think what we're finding effective is where housing authorities are partnering with service organizations, they're taking advantage of some of the additional funds that are available, and communities are doing really interesting and creative things with creating incentives for landlords, as well as kind of landlord risk mitigation funds where they can kind of create a kind of an insurance program in case anything goes wrong. So lots of creative things happening. I think the best thing that I've seen to be effective is when you fund people who can actually go out and know how to engage landlords, explain to them that there's how vouchers work. And also what communities have said in recent visit I took, one community said that when they have Medicaid finance wraparound services, that provides an assurance to the landlord that if anything happens, there's a number that they can call and there'll be a service provider who can come and help resolve a situation with a particular tenant.
Thank you, Richard. Thank you, Richard, Michelle, and Martha. I think Richard had mentioned earlier about the Housing and Services Resource Center website. You can find other federally supported resources on that website, along with information about funding opportunities that were mentioned today. and also models and partnerships that were mentioned. You can go to acl.gov/housing and services models. If we go to the next slide, we really want to hear your impressions of today so we can improve our webinar. We have a short feedback form in the chat. We'll put the link for the form. If you could just take a few minutes and fill that out, that will help us continue to make enhancements to make our webinars most effective to the audiences that we're providing them for. It'll also help us understand what your thoughts and ideas are about topics that would be helpful to learn more about. We go to the next slide. Today was the first in a short webinar series. Next week on the 15th of March, we hope each of you will return for the next event that will feature presentations from housing, home and community-based services, and health services on their state and community level partnerships to bring together housing and services. We'll be featuring Washington State and Massachusetts, so please join us. We go to the next slide. Hopefully you've heard some opportunities you can act on in the coming weeks. Before we close, I want to remind everyone that in the coming days, we'll post the recording of this webinar, the FAQs, and the slides for the HSRC website. Thank you so much for your participation today. In the meantime, please use the links that staff are putting in the chat to register for the March 15th State and Local Partnerships webinar. Visit the HSRC Models and Partnership page, complete the webinar feedback form, watch for our emails when the webinar recording and slides are available. Please email us with any questions or additional information you'd like to share at hsrc@acl.hhs.gov. And if we go to the next slide, we want to thank Mission Analytics, US Aging, the ASL interpreter, and our CARD specialists for their roles in producing today's webinar. And we're especially grateful for all of you who joined us today and for our federal colleagues and speakers. Thank you and have a good afternoon.